Have you ever wondered what all those weird names mean, like orthostatic intolerance, POTS, postural orthostatic tachycardia syndrome, neurally mediated syncope or hypotension? So my name's Nathan from Active Health Clinic, and today I'm going to run through actually what these terms mean in a really simplified way. I'm going to smarten them up so that we all understand. So first of all, orthostatic intolerance is the term that we tend to use most of all, and this is because it's a bit of an umbrella term. It has a lot of different things underneath. So simply, orthostatic means blood pressure, and intolerance means you're not very good at it. So it's about basically not maintaining or regulating our blood pressure as well as we should. Now, often we hear about POTS, and this is the most common one. And it stands for postural orthostatic tachycardia syndrome. And I think this is one of the best and most descriptive names actually going on. So postural doesn't mean my poor shoulder position now it's maybe better, or anything like that. Postural means change in position. So more from, say, going lying or even sitting to standing. So postural change. Orthostatic, as we mentioned before, is more around blood pressure. Tachycardia means fast heart rate. So that's often a heart rate above 100 or an increase of 30 beats, but it just means fast heart rate. Whereas bradycardia is actually the opposite. It means slow heart rate, but not what we're looking for here. And syndrome means that we don't know why it happens. So postural orthostatic tachycardia syndrome is change in positioning, managing blood pressure, fast heart rate as a response, and we don't 100% understand why. Now that's not really the case. We do understand that that heart rate response is actually about the body's motor going faster to maintain blood pressure, but that's sort of one of the responses that comes with it. Now, the other term that we often hear is neurally mediated syncope or hypotension. So breaking this one down, neurally, a nervous system. Mediated comes from, syncope is a fancy word for fainting. So neurally mediated syncope means that our nervous system isn't managing our body or regulating our blood pressure as well, which leads to us fainting. And neurally mediated hypotension is about them having neurally, so nervous system makes us have lower blood pressure. Now, these are very simple ways of explaining these, but I think it's really helpful for us to understand because these big terms are scary. Tachycardia sounds like you're on ER or one of these shows that is really scary. But if we understand, these simple ways or understandings of it, it means that we can change our behaviors. So postural, we can be careful in getting up. Orthostatic, managing our blood pressure. Tachycardia, understanding that our heart rate does get higher, and that's not a bad thing. And syndrome, well, that's what we work on and helping people understand as to why. So it could be because of neurally mediated, it could be because of hypermobility, it could be because of chronic stress in the body, or even a mast cell activation syndrome. There are lots of different reasons, but that is another video in itself. So hopefully that makes more sense and you can understand what those terms are, be able to explain to other people. And if you know someone else that would benefit from this, then please share it. But otherwise, we'll hear from you soon.